Good afternoon, everyone. Welcome to the Arizona State Office of Rural Health webinar series. Our State Office of Rural Health, aka SOAR, provides technical assistance to rural stakeholders to disseminate research findings, policy updates, best practices, and other rural health issues to statewide rural partners and stakeholders. Please let us know if you can see the screen and if we're coming across loud and clear. This webinar is brought to you by the Arizona Center for Rural Health. Our mission is to improve the health and wellness of rural and underserved populations. This webinar was also made possible by our partners. Thank you to the Arizona Telemedicine Program and the Southwest Telehealth Resource Center. Whoa. Just a couple of housekeeping tips. This is in webinar mode, so you will be muted for the duration of the webinar. We're going to be covering a lot today, so if you do have any questions or comments, we will be having a Q&A at the end. But if you have a question in the meantime, please feel free to utilize the chat function. This presentation will be recorded and will be available on both the AZCRH website listed here, as well as the Southwest Training Resource Center. And both those links are on the slide and will be available in the chat. Okay. So our presentation today is the Overdose Recognition and Naloxone Administration Training. This was a training made with a lot of support from ASCHO, which is the Arizona Community Health Workers Association. This training was intended for community health workers, representatives, and promotores, but has been recently expanded to be applicable to other members in the community as well. So we thank our partners for that support as well. My name is Lena Cameron. I'm a health educator assistant for the Arizona Center for Rural Health. My co-facilitators today are Aime Gutierrez. She is a health education and promotion professional here at the center, and Bianca Santamaria, who is also a health education and promotion professional here at the center. So in this training, we're going to be mentioning a workbook. So I just want to direct your attention to a couple of links here, which I'll put in the chat. This is our website with all of our materials and also our option to request your own one-on-one training for your organization. Down here. And here you'll find all the materials such as the workbook and one of our activities that we'll be going through today. So I'll put these links in the chat as well. And if you'd like to take a moment to just go ahead and open those up and peruse, we'll be getting started shortly. And just a quick disclaimer, if you feel like you need a minute alone for self-care, we recognize that we're going to be talking about some pretty heavy topics. So if you feel the need to step away for a moment or take a break, we completely advocate for self-care in that regard. Alrighty. Today we'll be going over terms such as adverse childhood experiences, trauma, substance use disorder, opioids, naloxone, and others. We're going to be summarizing the current opioid epidemic in Arizona, as well as identifying the relationship between trauma and substance use. We're going to be recognizing the signs of an opioid overdose, as well as going over the steps to respond to an opioid overdose. We're going to be identifying aftercare next steps, including going over some community resources later on. Finally, we'll be wrapping up with defining some risk reduction messages and providing additional resources to show clients and communities. And all of these are listed in that workbook. So we like to kick it off with a brainstorm and a couple of poll questions. We just would like to know who's attending, and what kind of jobs you do, where you're located. So I think we have a couple of poll questions. Thank you. So I see the first one. Okay, we'll give everyone a couple seconds to go ahead and answer that. All right, it looks like we have a pretty good mix here. Very cool, and I think we have one additional question here. Okay, looks like we have a good mix here. So we like to kick it off with a brainstorm to kind of get everyone warmed up. So please feel free to use the chat function. But what is an opioid? And there's no wrong answers right now. Just kind of just getting the juices flowing here. Keep an eye on the chat. Medication to treat pain. Chemical substance that attaches to the opioid receptors in the brain for sure. Okay. What have you heard about naloxone? Yeah, opioids can be natural or synthetic. Used to treat an overdose, yep. Antagonist of an opioid, sounds like we have an expert here. Helps when a patient overdoses, for sure. Yeah, life-saving, absolutely. For overdose, yep. Awesome. So getting into some more experiential questions here. Opioid reversal medication, for sure. What concerns you about using naloxone, if anything? Identifying signs of when to use it. We'll go over that. Hurting myself? Yeah, we can address that. Quickly prepping the med, for sure. Saving or not saving someone's life. Yeah, it's an intense situation no matter what, right? Nothing. Naloxone saves lives. I like that. That's awesome. All right. Being quick enough, for sure. Yeah, and we'll talk a little bit about that too. So wrapping it up, what are you experiencing in your community right now, either with opioids in general, overdose, naloxone access? What's kind of going on in your neck of the woods? High rate of overdose, fentanyl overdoses, yeah. Limited naloxone availability. Fentanyl overdose, working in a hospital, a lot of opioids to sick patients. Pregnant moms using fentanyl. COVID put it in overdrive. For sure. All right. Well, thank you so much to everyone that participated. Doctors not signed up for the PMD for sure. Yeah, thank you so much for your input, and we'll have a couple more activities throughout the presentation. Oh, I'm sorry about that. Family member recently overdosed. But hopefully this training will be pretty helpful for everyone in the community. All right, moving on. If we can get this. Okay. So We got a couple of right answers in the chat when we were doing this. Opioids are pain medication. Heroin and prescription opiates are called opioids because they bind to the opioid receptors in the brain. Prescription opiates include medications like Vicodin, Oxycontin, and Percocet, and can be prescribed by a doctor or taken illicitly. They increase pain tolerance, cause drowsiness, and can produce feelings of euphoria. Opioids can cause painful withdrawal because they can create this physical dependence, which can result in a painful and difficult withdrawal period if they're stopped being taken suddenly. All right, and I think Aime is going to walk us through our second activity.
Hello everyone, so now we're going to fill in the blank together. I'm going to go ahead and re-put the activity link in the chat just in case you weren't able to open it before. So with activity 2 that you downloaded from our website, chr.arizona.edu/programs/naloxone, click and view and edit to type directly into the Word document. You're going to fill in the blank while we review terms to support people. So, fear of judgment often stops people from seeking help, so it's important for us to use words that are kind, positive, and inclusive. This type of language reminds people that they're important community members, and we as a community are advocates that we can role model this positive behavior. Instead of saying clean, you can say negative, like a negative test result, or not currently using substances, or sterile, like a sterile needle. Instead of saying dirty, you can say positive, like a positive test result, a person who is using substances or not sterile, or not sterile, like a sterile needle or used needle. Instead of saying addict or alcoholic, which can both be very stigmatizing, say a person with substance use disorder or a person who uses drugs. You might hear people who use drugs use some of these terms, and that's okay. It's our job to encourage people who don't use drugs, especially those in power, like a doctor or a loved one, to be mindful of the words they use. So I'm just going to give you guys a quick minute to type these into your document. You can refer back to them on our website, on our workbook, if you need to review the answers. And then if you have any questions, you can go ahead and put them in the chat as well. Okay, we're going to go ahead and move on to the next. So here are a few terms that you can use that are a bit more positive. Instead of abuse, you can say drug use or opioid use disorder. Instead of saying ex-drug addict, you can say a person in recovery. Once you're all done copying these down, please read through page 6 in the workbook. And after the training, and you can use this as a tool. And then once again, all the answers are on the workbook that you can access through our website. Understanding addiction. Addiction is not a moral failing. It's a chronic relapsing brain disease. It is a medical chronic condition, just like diabetes, and understanding the cause and terminology is helpful in reducing the stigma that keeps people from getting help. 45% of those diagnosed with substance use disorder will also be diagnosed with mental disorders. It changes the way someone's brain functions and how it's structured. There are many things that can contribute to someone using drugs, including early experiences and hereditary, environmental, and social factors. Childhood trauma and substance abuse. Addiction is not a decision. It's a disease rooted in both individual and historical trauma. Historical trauma is the multi-generational trauma experienced by a specific cultural, racial, or ethnic group. And here are a few statistics to consider. 1 in 15 veterans have substance use disorder. 75% of women who enter treatment programs reported having experienced sexual abuse. Adverse childhood experiences, also known as ACE, are factors that can impact someone's future substance use. There is a screening tool to see what your ACE score is. The higher the ACE score, the higher the likelihood of someone developing a substance use disorder. There are resiliency and protective factors that can help prevent and address ACEs. Everyone can take the ACEs questionnaire in your workbook on your own time. There are tips to prevent and address ACEs in your workbook too. So here we have a few resiliency factors. People respond to ACEs differently. Having adverse childhood experiences does not mean negative health outcomes are set in stone. There are things that can be done either to prevent or lessen the impact of ACEs that can allow people to adapt to adversity. Things like knowing what resources are out there for parents, such as rent assistance and parenting classes. Encouraging youth to get involved can also allow them to find community. Just one healthy positive adult being present in a youth's life can really make a difference. And then now we have a few risk factors for overdose. It's important for everyone to know the risk factors of overdose to teach our community what to look for. This is a harm reduction approach, just like telling someone to wear a seatbelt. People are at a higher risk if they mix their drugs, like if someone mixes their wine with an opioid and benzodiazepine like Xanax. Someone can be at greater risk for an overdose if they purchase their substance or drug from an unknown dealer. Many are being laced with fentanyl, which can cause an immediate overdose. Fentanyl is a man-made opioid that's 50 times stronger than heroin and 100 times stronger than morphine. It can also be caused by low tolerance. If someone has been without drugs for a long time and they use at the same level they used to before, they are at greater risk for overdose. Like if someone, for example, was recently released from jail or prison. If someone uses alone or they're suffering from other health problems, such as a weak heart or HIV or AIDS, they're at greater risk for overdosing as well. And then here are some signs of an opioid overdose. This will help you identify if someone is overdosing from an opioid and if naloxone will work to save their life. The person overdosing will not wake up. They will have blue or pale skin, lips and nails, and their body will be very limp. Their heartbeat will be slow with irregular or absent breathing. They'll likely make a gurgling or choking sound and have pinpoint pupils like the image shown on the screen. We're going to watch a video to see how to identify and respond to an opioid overdose.
Remember that use of any opioid may cause side effects such as slow or stopped breathing and can lead to an overdose. But how do you know if someone may be experiencing an opioid overdose? Overdose happens when someone takes more or stronger opioids than their body can manage, leading to respiratory depression or a suppressed urge to breathe. Some possible signs of an overdose include being unconscious or passed out, slower or stopped breathing, lips or fingernails turning blue or gray, depending on skin tone, making snoring or gurgling sounds, and in cases of fentanyl overdose, we've also heard of cases where people become extremely rigid or stiff. While it's rare for someone to die immediately from an overdose, it is important to respond quickly. When people survive, it's usually because someone was there to respond. Keep in mind, someone who isn't overdosing may be drowsy or sedated, but they will respond to an external stimuli like a loud noise or a shake. So, what can you do if you're worried someone might be overdosing? First, check for responsiveness. The easiest way is to do a shake, shout, and rub. First, shake the individual as if you're trying to wake them from a deep sleep. Then shout,
"Hey, can you hear me?"
If the person does not respond to being shaken or shouted at, then do a sternal rub. Make a fist and rub it, applying some pressure on the person's sternum or breastbone for about 5 to 10 seconds. If the person responds, monitor them and keep naloxone ready. The person should not be left alone. If they don't respond, it's an emergency. The first thing you should do if someone doesn't respond to the sternal rub is call 911. It's important to have backup on the way. There can be complications, or the person might be having a different kind of medical emergency. With some exceptions, the 911 Good Samaritan law provides protection to someone overdosing or someone calling 911 to save a life, even if drugs are present. Next, give naloxone if you have it. Naloxone is available as a nasal spray or an injection. In this video, we'll provide instruction for the single-step Narcan nasal spray. Narcan comes in a blister pack like this. Peel the package to remove the device. Put the nozzle in either nostril until your fingers touch the bottom of the person's nose. Press the plunger firmly to release the dose into the person's nose. It's important not to test the device or press the plunger until the nozzle is in the person's nose. All the medication is dispensed once the plunger is pushed. Narcan can take 2 to 8 minutes to work, and sometimes more than one dose of naloxone is needed. If the person has not become responsive after 2 minutes, give a second dose. If you can, try using the other nostril this time. If you don't remember which one you used, don't worry, just give the second dose. Hopefully, after giving 1 or 2 doses of naloxone, the person will become responsive. If this happens, first, tell them what happened. They may be confused. Explain that they were overdosing and you gave them Narcan. If the person takes opioids regularly, they might experience withdrawal symptoms until the naloxone wears off. It's important to explain that naloxone lasts between 30 to 90 minutes and that using more drugs is unlikely to reduce withdrawal, but it could increase the risk for another overdose. Medical attention is important. Encourage the person to wait for the ambulance. The person who overdosed shouldn't be left alone for at least 3 hours, since another overdose is possible when the naloxone wears off. If a person doesn't become responsive right away, it's important to know about the recovery position. Place the person's arm or hand under their head. Tilt their head back slightly to open an airway. Bend the arm and leg that's furthest from the ground to prevent them from rolling on their stomach. In addition to calling for help and giving naloxone, you can also do CPR if you know how, or simply provide rescue breaths. Getting oxygen to an overdosing person might reduce serious complications and can keep a person alive until help arrives. In your kit, you will find a rescue breathing mask that can act as a shield between you and the other person. Place the person on their back, tilt their head back, and open their mouth. Place the face mask over their nose and mouth to create a barrier. Pinch the person's nose closed and give 2 regular breaths into the mouth. Continue with 1 breath every 5 seconds. Ensure that their chest is rising and not their stomach. Readjust if necessary. Let's wrap up by reviewing what you can do if you think someone might be overdosing. First, check for responsiveness. Shake, shout, and rub. If they don't respond, call 911. Backup is critical, especially in light of fentanyl in the drug supply. Next, give Narcan. Remember the simple steps: peel, place, and press. Don't forget you have a second dose in case the person doesn't respond within 2 minutes. If the person wakes up, it's important to explain what happened and encourage them to go with the ambulance. It's important that they're not alone for at least 3 hours in case of another overdose. And don't forget the recovery position and rescue breathing are important tools in emergency response. You can review.
All right, and we have one more video going over intramuscular naloxone.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? Injectable naloxone comes in a 1 milliliter single-dose vial, similar to this one, and it can be given intramuscularly in the patient's deltoid on their upper arm, their quadriceps on the outer aspect of their thigh, or their gluteal muscle on the upper portion of their backside. To prepare a dose, we'll first remove the plastic cap from the vial and grab your needle and syringe. Now, since we're injecting this medication, we want to try and keep the rubber cap and the tip of the needle clean, so avoid touching those as you prepare your dose. Remove the cap from your needle and insert it into the rubber stopper. Now you'll withdraw the full contents of the vial. There should be at least 1 milliliter of fluid and maybe slightly more due to overfill, but withdraw the full contents. Now we'll get rid of any bubbles by sharply tapping the syringe and removing any air so that we're left with 1 milliliter of liquid. Now your dose is ready for administration. Today I'll demonstrate how to give a dose of injectable naloxone in a patient's deltoid muscle. When giving an intramuscular injection, you'll first remove the patient's clothing to expose the skin. Feel for the bony edge of the patient's shoulder. Place 2 fingers beneath that, and the triangular area here is the deltoid muscle, and that's where you'll be giving the injection. If available, clean the area with an alcohol swab. Then, pinch the muscle to form a firm surface. Insert the needle at a 90-degree angle and inject the dose of medication. Remove the needle and dispose of it properly. Do not recap your needle. Now that the dose has been given, the patient should start to respond within 3 to 5 minutes. However, if they're not responding, it is safe to give a second dose of naloxone in an alternate injection site if you have another dose available. For more specific questions on how to...
All right. Back to our PowerPoint.
Okay, so here we have the 911 Good Samaritan Act. The Good Samaritan Act was passed as part of the Arizona Opioid Epidemic Act to encourage people who encounter someone overdosing to call 911 and not be prosecuted for drug possession. Someone is considered a Good Samaritan if they are seeking medical help for someone who is overdosing, and if drugs are discovered when medical help arrives. The same goes for a person who has overdosed. There are limits to this law, so do seek legal assistance for guidance. And now my coworker Bianca is going to take over the next few slides.
Okay, so now we're going to talk a little bit about aftercare. So, or side effects, I'm sorry. Someone can experience possible reactions to naloxone. Their body might feel like they're going through withdrawals and are having an extremely painful flu. Give the individual space after you use the naloxone on them. They may feel sick, throw up, or experience any of the side effects listed here. Withdrawal is very painful, so be gentle and say you overdosed and we use naloxone. Take a second to breathe. Aftercare. It is important to stay with the person once they wake up from an overdose because another overdose could happen. EMS can take them to the hospital, though the individual can refuse medical care. They might be uninsured or undocumented or have another reason why they might not want care. If they refuse medical care, someone should stay with them for several hours and keep them awake. Overdose is a very scary thing, so staying calm yourself is important. Sometimes overdose can be the thing that encourages someone to get treatment. Naloxone can last 30 minutes to an hour and a half, which is why it is very important to monitor someone for several hours after an overdose. The person could have another overdose, so don't leave them alone. Note, naloxone will not cause another overdose, and it does not work on overdoses from other substances. If someone is not overdosing on an opioid and you gave them naloxone, naloxone does not have a negative impact. For example, if someone took cocaine with fentanyl and overdosed because of the fentanyl, the naloxone would work. If there wasn't an overdose from fentanyl, naloxone wouldn't work. So always be observant of that and be cautious. Okay, now talk about community resources. In Arizona, we have a few statewide resources that everyone can use in their communities. Anyone can call the OAR line or the Arizona 211 for research support. You can look up where to dump your drugs at dumpthedrugsaz.org. Anyone can look up behavioral health treatment providers on the SAMHSA website. In case you need naloxone, there are free or reduced naloxone locations at spwaz.org, Arizona Naloxone. All these resources are in your workbook for quick reference. So with all these things available, we still ask, why don't people get help? Even though these resources are available, getting help is not as easy as it may seem, especially for our rural and underserved communities. There are limited treatment options, even with investments in behavioral health. Drug use is the #1 stigmatized issue in the world. A person might be ready to recognize and accept that they have a disorder. Sometimes it can be expensive and in a completely different city. Withdrawal can be very painful and scary, as can fear of being arrested or isolated from someone's social support network. These systems can be very negative and very hard to navigate at times, which is where you can step in as community health workers and representatives. Sometimes people fear losing jobs, their house, their relationships, and families because of how stigmatizing drug use is. So, as part of the journey, relapse and remission is part of the journey that you go through. It is a very normal part of any chronic disease. It can take a few years to recognize and admit that they need and want help. It is a lifelong journey, and relapse is a part of the recovery process. Relapse is normal and common, and has similar relapse rates to other chronic diseases like diabetes, asthma, and hypertension. Because we are talking about the most stigmatized topic in the world, we tend to hold people with a substance use disorder to a higher standard than people with diabetes, for example. Someone with diabetes can be really well controlled, and then they have a stressful experience that might trigger eating habits that increase their blood sugar. It is a similar experience for someone who uses drugs. So everyone in this training can offer support now. Use your motivational interviewing tools. Remember that we are not here to diagnose someone. We are here to support someone and help them access care. Use person-first language. Remember that words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. Everyone here can offer harm reduction tips. Some examples are in your workbook for you to check after the training on page 27, the harm reduction tip sheet. So the main points of harm reduction for opioid use are, if someone is actively using drugs, don't use alone. 2, go slow. 3, use a fentanyl test strip. 4, know how to recognize the symptoms of an overdose, like pinpoint pupils, gurgling sound, and others that we discussed. 5, learn rescue breathing, which we discussed, and always carry naloxone. Okay, so looking back at our parking lot, what questions do you still have, or what are you still unsure about?
So there was one question we got when we were playing videos, and we did discuss it a little bit, but I just wanted to emphasize it. They asked, if someone is overdosing from something that isn't opioids and you give them naloxone, will naloxone have a negative effect? And the answer to that is no. You're still going to have to deal with that overdose from the other substance, but naloxone itself won't do anything. I'm seeing in the chat, What are fentanyl test strips? So fentanyl test strips are a kind of a hot button issue right now because we just got legislation passed here for them not to be considered paraphernalia, which means that people can now use fentanyl test strips, which are they're little strips that you can test your substance with. So you can test it either in batches, you can test just what you're using to see if there's fentanyl in the substance or not. And so this can be used with pills, with regular opioids, with heroin, with meth, and stimulants such as that. So yeah, it's a tool that people can use to identify whether or not their substance is contaminated with fentanyl.
So any other questions?
Thank you.
Okay. So the 3 key takeaways we want everyone to leave with is that people who use drugs are not bad people. They're just people. A substance use disorder is a chronic relapsing brain disease, and naloxone reverses an opioid overdose. So save a life and carry naloxone. Thank you everyone for joining us today and for the time you took. Just a reminder, we do ask you to please complete your evaluations. We appreciate your time and are here to answer any additional questions. The link is in the chat box for the evaluation. And so thank you, Aime and Lena, for co-facilitating with me, and thank you everyone for attending today. If there are any last minute comments, please type them now or in the chat box. We can be reached at the emails listed here. If you would like to schedule a virtual training for your staff, please go to crh.arizona.edu programs/naloxone and click request training. The recording will be available in the next few weeks at the site listed in the middle of the slide. We greatly appreciate your time and commitment to improve the health and wellness of Arizona's rural and underserved populations. Thank you, everyone, and enjoy your day.
And while people are leaving, I do see one question in the chat that's kind of lingering. Can people be addicted to Narcan? No. So naloxone or Narcan is actually just a substance that like knocks the opioid right off the brain receptor. So there's really no incentive to use it just for like recreation. There's no euphoria or anything. Yeah, thank you very much.
Thank you. And then I know Soraya had a question, when will this webinar recording be posted? And it should be in a couple of weeks in the listed website. And then Maria had a question on how expensive is naloxone?
So you can use that link that we put in the slide. It's also in your workbook to identify through Sonoran Prevention Works interactive map. But there is currently an open prescription right now, so you can go to any pharmacy, and it will depend on your insurance how much the copay is. I've paid $40 with my insurance, but Access members get it for free at many pharmacies. So kind of tying it in with this other question, where can I get naloxone? I really highly recommend Sonoran Prevention Works map. You just plug in your zip code and it will pop up. But also because there is an open prescription, you can go to any pharmacy and say, hey, I'd like naloxone. And just depending on your insurance, it'll be different copays. For sure. Yeah, thank you, Angelina. Yeah, Pima County Libraries also distribute naloxone for free. And Pima County Health Department will also distribute those. No problem. Great questions. Is SPW still having a shortage for naloxone? Yeah, so they just actually did a press conference over that topic, and I think it's available on their Facebook page if you were interested. And so that is just for the intramuscular versions that they hand out, but like the Narcan, the actual nasal spray, isn't affected by the shortage. And those are usually what you would get at a pharmacy.
Okay, well, thank you, everyone. If there isn't any further questions, again, feel free to contact us through email if you have any further questions. Be happy to assist you with that. Thank you all for your time.